evening from New York. I'm Lawrence O'Donnell in for Keith Olberman. The House of Representatives today released its health care reform bill, including a public option, a government-run health insurance alternative for people currently without health insurance. President Obama praised the bill, but criticism from both the right for how much it will cost and the left for how little it will do. Our fifth story on the countdown tonight, what Nancy Pelosi thinks she can get and not get in health care reform. The Speaker of the House today celebrating on the Capitol steps, listing what the 1,990-page bill accomplishes or will accomplish if something like it passes both House and Senate, including ending antitrust protections for insurance companies and eliminating their ability to reject people for coverage based on pre-existing conditions. Between now and 2013, when the public option would kick in, a fund for a temporary high-risk pool would provide a stopgap for those unable to get private insurance. Speaker Pelosi also touted the bill's fiscal responsibility.
It reduces the deficit, meets President Obama's call to keep the cost under $900 billion over 10 years, and it insures 36 million more Americans. 36 million more Americans. As I said, the bill is fiscally sound, will not add one dime to the deficit as it expands coverage, implements key insurance reforms, and promotes prevention and wellness across the health system. The bill will expand coverage, including a public option to boost choice and competition in the health insurance reform.
Congressional Budget Office Director Doug Elmendorf, several hours later, released the CBO's estimate of the bill's financial impact. The bill would make health insurance mandatory for most people and fine companies with payrolls over $500,000 that do not offer health care plans. It adds an excise tax for makers of medical equipment and raises taxes on individuals making more than $500,000 and couples making more than $1 million. Most notably, the CBO said the bill will both cost more, over $1 trillion, but also offset more in taxes and spending cuts than Speaker Pelosi estimated. The bill, however, would still meet President Obama's requirement that it not add to the deficit. The CBO estimating it would actually reduce the deficit by $104 billion over 10 years. President Obama said in a statement, quote, "The House bill clearly meets two of the fundamental criteria I have set out. It is fully paid for and will reduce the deficit in the long term." The most dedicated veteran of the health care fight, Michigan's John Dingell, who presided over House passage of Medicare in the 1960s and whose father introduced the first universal health care bill in Congress in 1943, pushed back against GOP claims that the bill's Medicare cuts threaten seniors.
The only citizens who are going to have to worry about their participation in Medicare being cut are the insurance companies. Some of them are getting paid 150% of what they're entitled to. And that's being paid, curiously enough, by other American citizens, retirees.
In response, Republicans seemed dumbfounded that Democrats were not cowed by the Tea Party rabble-rousers sent by Washington lobbyists to disrupt town hall meetings on health care reform.
Over the last several months, the American people have spoken, and it's pretty clear that our Democrat colleagues have not listened. Through the month of August, September, the American people, members of Congress from both sides of the aisle, know that they wanted no part of a government-run health care plan.
In fact, moderate Democratic Senator Evan Bayh of Indiana today faced with a new poll suggesting voters would punish him for helping Republicans block a vote on health care, as well as a request for clarification of his position on this program last night, seemed to take a clarifying step in Harry Reid's direction, despite previously saying allowing debate on the bill would be equivalent to supporting it. Today, he released a statement saying, quote, he will support moving forward to a health care debate on the Senate floor. Bayh, whose wife sits, somewhat uncomfortably no doubt, on the board of health insurance giant WellPoint, has still not said whether he would help Republicans block a vote on health care. and has still not provided an answer to our question of whether he has ever voted to allow a vote on something he has opposed and then voted against the final passage of the bill. The Service Employees International Union, however, told us they have researched this and turned up at least 3 such incidents in Bai's voting record. Some intense and heartfelt opposition to the House bill came from the left today. Leaders of the Progressive Caucus meeting with President Obama today, urging stronger support from him for a stronger public option. And Congressman Dennis Kucinich tore into the House bill, especially for forcing people to buy the health insurance industry's faulty product and fatten their profit margins, and for forcing the government to negotiate its rate of payments to providers rather than tie them to the lower Medicare rates, which would have saved taxpayers $85 billion.
Is this the best we can do? Mandating private insurance, forcing people to buy private insurance policies or pay a penalty, guaranteeing at least $50 billion in new business for the insurance companies? Is this the best we can do? Government negotiates rates which will drive up insurance costs, but the government won't negotiate with the pharmaceutical companies, which will drive up pharmaceutical costs. Is this the best we can do? Only 3% of Americans will go to a new public plan, while currently 33% of Americans are either uninsured or underinsured. Is this the best we can do, eliminating the state single-payer option while forcing most people to have to buy private insurance? If this is the best we can do, then our best isn't good enough, and we have to ask some hard questions about our political system, such as health care or insurance care, government of the people or government by the corporations.
Our guest tonight is the former governor of Vermont, former chairman of the Democratic National Committee, Dr. Howard Dean, currently a consultant to both Democracy for America and McKenna, Long and Aldrich. And lest we forget, a contributor for CNBC. Thanks for your time tonight, Governor.
Thanks for having me on.
Governor, let's go to Dennis Kucinich's question right off the bat. Do you disagree with any of the points he made in that speech? And ultimately, is this the best we can do?
It's not the best we can do, but it's a very good start. Look, they were fighting uphill against a very well-organized opposition, which has a lot of trouble telling the truth, and against an incredibly well-organized health insurance industry, which has given millions and millions of dollars to some of the people who are going to have to vote on this stuff. So I think this is, look, I don't disagree entirely with Dennis, but the fact is this is real reform. That's all I really care about, is real reform. People are going to have a chance to get into a different kind of a system that doesn't take huge profits out and put it in their own pockets, and where only 4% of all the money that we put in is spent on things that don't have anything to do with health care. So are there some things? Yeah. The most important thing that probably needs to be changed in conference committee is more people need to get into the system before the 2010 elections. The only way to defeat all the things that the opposition is saying that aren't so is to actually show them how the system works. It really is pretty good. It's going to be very good for a lot of people. I think this is going to work well. I think it's a great bill. I think the Speaker has a lot of courage, and I'm very, very pleased. And I think Senator Reid did a terrific job last week on the same thing. I think we're in good shape. We're going to have some bad days still, I'm sure, but we're in very, very good shape now.
Now, Governor, the biggest difference between the House bill and the Senate bill is now on the tax side. The Senate wants to tax union health care plans. That is opposed by over 170 Democratic members of the House. The House wants to tax rich people, wants to tax people above, individuals above $500,000 of income, couples above $1 million of income. These seem like irreconcilable differences. One of those taxes has to win. Which one do you think it will be?
Fighting over money is never irreconcilable. It's just a number, and there's always a number in the middle to get to. So I'm not the least bit worried about that. What I'm worried about is making sure the public option does well and as many people can get to sign up for it as possible. And I'm worried about what's going to happen to the Democrats in 2010. Again, the only way that we can show the country that the Republicans have just not been telling the truth for the last 6 or 8 months about this bill is to actually have it put in effect. And once it goes in effect and especially people's kids start getting an insurance, this debate is over, and we're going to, instead of losing seats in 2010, we're going to pick up some seats in 2010.
Now, when Barack Obama ran for president, he said that on the taxation side, you could pay for health care simply by allowing the Bush tax cut on the top tax bracket to expire. We now see that the House is